Why are lung adenocarcinoma subtypes important? Imagine trying to fix a complex machine without knowing which part is broken. That's similar to treating lung cancer without understanding its specific subtype. Lung adenocarcinoma is the most common form of lung cancer, and it actually includes several different subtypes. These subtypes are important because they tell doctors a lot about how the tumor behaves, how aggressive it might be, and what treatments could work best. Lung adenocarcinoma is classified based on how the cancer cells look under a microscope. The World Health Organization groups these into different categories like adenocarcinoma in situ, minimally invasive adenocarcinoma, and invasive adenocarcinoma. The invasive type is further broken down into patterns such as lepidic, acinar, papillary, micropapillary, and solid. Each pattern reflects different biological behaviors of the tumor. For example, tumors with a lepidic pattern tend to grow slowly and have a better outlook, while micropapillary and solid patterns are more aggressive and linked to worse survival rates. Knowing the subtype helps doctors predict how the disease might progress. For instance, if a tumor has a lepidic pattern, the prognosis is usually very good, and less aggressive treatment might be enough. But if the tumor shows micropapillary or solid patterns, it might need more intensive treatment because it can grow and spread faster. This information helps in planning the best approach for each patient. Another reason these subtypes matter is because they influence treatment choices. High-grade patterns like micropapillary or solid types often mean the patient might benefit from additional therapy after surgery, such as chemotherapy, to reduce the risk of the cancer coming back. On the other hand, lower-grade subtypes might be managed with surgery alone. Knowing the subtype allows doctors to personalize treatment plans, making them more effective and tailored to the individual. Subtyping also plays a key role in molecular testing. Many lung adenocarcinomas have genetic mutations that can be targeted with specific drugs. For example, mutations in genes like EGFR or ALK are common. When doctors know the tumor subtype, they can decide which genetic tests to run. If mutations are found, targeted therapies can be used, which are often more effective and have fewer side effects than traditional treatments. Accurate classification of subtypes is especially important when tissue samples are small, like in biopsies. Correctly identifying the subtype ensures that the right tests are done and the right treatment is chosen. It also helps researchers develop new treatments and design clinical trials by grouping patients with similar tumor types. This way, new therapies can be tested more effectively on the right groups of patients. In summary, understanding the different subtypes of lung adenocarcinoma is crucial because it provides vital information about prognosis, guides personalized treatment, helps identify genetic mutations for targeted therapy, and improves diagnosis. This detailed classification ultimately helps improve outcomes for patients and advances the way we treat lung cancer. If you or someone you know is facing lung cancer, it's always best to discuss these details with a healthcare professional who can provide guidance tailored to the individual case.